Hi, welcome back to Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley, the dermatologist here at the hospital, and I've got Dr. DeLeo, who is our emergency doctor here, and we are going to be talking about all things about xylitol toxicity, and maybe hitting on some chocolate toxicity too. But for a lot of you, you may have never even heard of xylitol before, so I'll give it over to you to explain what xylitol is and what it can do to dogs.
So xylitol is an artificial sweetener that is found in a lot of candies, some peanut butters, and most commonly what we see it in is gum. Like most of us that have gum have had some kind of sugar-free gum, and the sugar-free gum is made with xylitol. So it's found in sugar-free products. And those are kind of the
sweetener, right?
Yeah, it's a sweetener, and those are the main three. And for dogs specifically, it can be toxic to them. What happens when they eat a lot of xylitol, or they don't actually have to eat a lot of it, it can be a pretty small amount, is that their body mistakes it for true sugar, and they have a really big release of insulin in their body, which makes them have actually truly low blood sugar. And so that's what they're coming into the hospital for typically, is treatment for really severe low blood sugar.
Wow, so it's like they get a boost in sugar right away and then it just drops.
Yeah,
basically,
yep,
because of the insulin release.
Mm-hmm.
Okay.
Yeah. And that can be sustained. Usually, they can have low blood sugar from anywhere like 12 to 24 hours, and that's usually pretty treatable in the hospital.
Okay.
Yeah.
All right. What would be one of the first signs that an owner might see with xylitol toxicity?
Well, I think a lot of the times, if they've gotten into gum, you find evidence of the wrapper somewhere or pieces of gum that they didn't get into. A lot of the dogs like the icebreaker cube containers, and so if you have those around the house, they will chew through the plastic, so keep those up high. So if you find evidence that they've eaten it, even if they're acting normal, you should bring them in to us right away. If you see them acting abnormal at home, though, signs are pretty consistent with the low blood sugar. So they might be weak, they might be lethargic, not able to stand or walk normally. They could be a little bit wobbly, and in really severe cases, we can see tremors and seizures from low blood sugar.
And are we talking about like a pack of chewing gum or just like a couple sticks?
It can be, well, it depends on the brand of the product and how much xylitol is in it. But it can be just a couple of pieces or cubes that can make them feel
not that much.
Doesn't take too much.
And do they have to swallow it, or is there any chance they might chew on this or vomit it up, or
they usually ingest it, so they've swallowed it, and it can cause some GI upset sometimes, and so sometimes they'll actually throw up a couple of pieces, which is good.
Yes.
What we do when they first come into the hospital is try to get them to vomit it up if it's been within that 3-hour period.
Okay, it looks like we've got a question.
We do. We have a question from Sue, and she is wondering, what about birch sugar? Still xylitol, right?
I don't know off the top of my head if that's xylitol.
Yeah, I've never heard of that before, but
I'm
if
not
it
sure.
contains xylitol and it says that, then definitely stay away from it. Yeah.
We can look into it though.
Yeah, absolutely. So then what do you do at the hospital? Obviously, you're probably giving them glucose. Is there anything else that we do for treatment for xylitol toxicity?
Yeah, so if they've come in, we know that they've eaten it. We like to decontaminate them by inducing vomiting. Usually we have like a 3-hour window where we can actually induce vomiting and have them bring up some of the gum pieces or candy, whatever they ate. And then they're oftentimes kept in the hospital. We give them IV fluids and we supplement them with sugar, with dextrose. That way we keep their blood sugar normal until they're able to maintain it on their own.
How long are they usually hospitalized for this?
So it can depend. In some cases, we can see liver toxicity happen as well. And so if they have liver toxicity, that can happen anywhere within the first 72 hours of ingestion. And so higher doses, we tend to keep them longer in the hospital so that we can keep track of their liver enzymes and support their liver as well. If it's the low blood sugar and their liver seems fine, I'd say they're usually in the hospital 12 to 24 hours.
Oh, okay.
Mm-hmm.
Right.
Yeah.
And any other animals that have this problem, or is it just dogs that we know of?
It's just dogs. Cats can have some component of insulin release like dogs, but it's not nearly as severe.
Okay.
And so in our hospital, it would be dogs.
Dogs.
Yeah.
Okay. And you said you primarily see it with chewing gum. Have you ever seen it with one of these peanut butters that use it?
Yeah, I personally in practice have not seen one of the peanut butter cases cause it, but definitely check your peanut butter labels because there are some peanut butters that have xylitol as the sweetener.
Yeah, and I think there's actually kind of a little bit of a I don't know, people were pretty upset that some of the brands were using xylitol in peanut butter because obviously that's kind of a common thing that people give dogs and use for pills and stuff. So just be careful. Make sure you're looking at your peanut butter and all of those ingredients, as well as all of the sugar-free candy that comes out for Halloween. But we also wanted to touch on a little bit about chocolate too, as another Halloween thing.
Yeah. Kind of the same recommendations is to keep them up high where your dogs can't get to them. Chocolates, candies, gum, and if they do get into them, of course give us a call and we'll let you know if you need to bring them in or not. And if you're ever unsure about what they ate or how much, you can always call poison control and they can help you determine if they need to come see us or not.
All right.
Yeah.
And would you recommend for xylitol, would you recommend that any amount of xylitol they eat, they come in? Because, yeah,
yeah,
it's so serious.
if they get into any xylitol, definitely bring them in.
Okay.
Yeah.
All right. Well, if you're just joining us, we've just been covering xylitol toxicity as well as chocolate toxicity, which is a great time to cover it with Halloween coming up. It's always important to keep those things out of reach with your dogs. If you guys do have questions, please feel free to chime in right now, although you can always chime in after the show and we'll be happy to answer those questions for you. Anything else owners should know about these two toxins?
I think those are the main things. Just if you've noticed they've eaten any, give us a call right away. Feel free to call poison control. They can also let you know if you need to bring your pet in, and then keep those items up high.
Yeah.
And if you have any concern that they maybe ate something and you don't see any obvious xylitol products, you can still give us a call or poison control a call and we can help determine if you need to bring your pet in.
Perfect.
Yeah.
Well, thank you so much for being on the show
Of
today.
course.
Really
Thanks for
appreciate
having
it.
me.
Oh, it looks like we've got a question, a last minute one.
Yes, Taylor was wondering about white chocolate and if that is a concern.
No, actually, so in chocolate toxicities, we're looking at the cocoa level in chocolate. That is toxic to our pets, and white chocolate doesn't actually have any, so not the same as milk chocolate or dark chocolate. And when we're looking at chocolate toxicities, the darker the chocolate, so the higher percentage of cocoa in the chocolate, the more severe the toxicity. So milk chocolate is going to be a little less severe than dark chocolate.
Perfect.
Yeah, and white chocolate, there's usually none, so.
Although still don't let your dog eat a ton of white
don't recommend
chocolate. It's a lot of added sugar, and of course dogs are predisposed to getting pancreatitis if they do that, so.
Yeah.
All right. Well, thank you guys for joining us.